Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hello everyone, my name is Ahamed, and I'm a third-year pharmacy student from the University of Iowa. And today I'll be interviewing Samm Andregg, who's a pharmacist that graduated from the University of Iowa College of Pharmacy. And also he completed a residency, a PGY 1 and 2, which was a health administration residency. And today we're going to be talking about his company, Docstation, which he founded and he is the current CEO of. So Sam, how are you doing?
Doing great, man. Thanks for having me on.
Yeah, of course. And so we're just going to start by asking you, what was your aha moment, or when did you actually start your business?
Great question. I feel like it was about 2 years into my first job. I had graduated pharmacy school, done 2 years of residency, and was managing several things in an academic medical center. And I was, by the outside looking in, performing really well. But I wasn't fulfilled or satisfied. I was, really actually depressed, and I didn't know why. And so I took that time to really interview at one place and ask myself some really tough questions. What is it that I really want to do? And took me some time, but I sorted through some things and, really looked up, software and how to get started, and literally Google searched how to start a startup. And there were some really great videos from Stanford University, to be honest. And it's one of these things where, you have to see what other people are going through and what other people do to do what you want to do, if that makes sense. And I realized these people talking about their startup and pitching their ideas were no different than you and I. They're regular people. They're not superhuman. They got started somehow. And really, that's what, flipped the switch in my head to say, hey, I can do this too.
Yeah. Well, that's fantastic. And when you first started this Docstation platform, or just, your own company, what was your mission at the outset of it? Like your initial goal?
Sure. My goal was, I worked with so many great colleagues, working directly with patients. I know the type of value that pharmacists can provide to patients. And I know there's value in that. It's about having the data to justify that. And I knew we didn't have a good software system or a good mechanism to do that at all. So at the outset, I wanted to create a tool that allowed pharmacists to get paid to spend time with patients, actually achieve the overall value to the healthcare system. We just needed something to measure that. So that was my initial goal on the outset. But it's evolved into something very different. It will be evolving into something very different, and we're excited about that as well on a larger scale.
That's awesome. That is great. And just to kind of expand from that, so I was actually on this Cario chat about a week or two ago, and we talked about the accessibility to pharmacists. And there's an issue currently and this chat included physicians, pharmacists, and different healthcare providers. And the big issue that the physicians had were they still believe that pharmacists' role in the healthcare system or the healthcare continuum is dispensing. So I didn't understand how can pharmacists become accessible, or they're not really sure how to reach out to pharmacists. So does your platform have any way to connect a pharmacist and physician, maybe?
Yeah, that's a very good point. A lot of the people that we talk to that maybe aren't directly involved in healthcare or haven't had the experience that maybe a pharmacist has had, don't really get it either. So what you realize is that there are pockets of really great collaboration between pharmacists and physicians, and those things have been developed over time. Working together, working alongside one another. A pharmacist sending interventions to a physician's office. Now, you look at the people like Randy McDonough at Towncrest in Iowa City, and those guys have been faxing recommendations for over 10 years, and it just takes a while to establish that. So how do we get there a little bit quicker? And I think it goes back to, pharmacists aren't motivated or incentivized financially to spend any time doing these activities, reaching out to physicians. They're still paid to count the pills. And that's why I think the outside community, even, the medical community, sees us as dispensers. And so how do we change that to allow pharmacists to, make it their job to go out and establish relationships with prescribers and build their role on an integrated care team, so to speak, in the primary care setting. So I think that's, one of the main issue. And we're definitely working on, technology that will facilitate that communication, completely bypassing the fax machine. And let's make it a little bit more modern and more easy for everyone. So that's definitely something that's a priority for us.
That's fantastic. Yeah. And so in terms of just your transition between working as you were a manager at a hospital as a pharmacy type manager. Was that your role before Docstation?
Yeah, I managed about 18 FTEs and, oncology service line and ambulatory care and specialty pharmacy.
Wow. So what did it take for you to say, okay, I'm going to leave this normal revenue stream behind and allow myself to take on this business, like put all my eggs into this one basket?
Man, it was hard. It was really hard. Because you work this entire period of your life, 6 to 8 years getting your pharmacy degree, 2 years of residency, and you get to this position. And I think, my mindset at the time was, being successful is being a chief pharmacy officer, being a director of pharmacy. And that's what a lot of my, my peers believe too about them after they graduate, administrative residency. And, I just kept thinking like, okay, what does my life look like in 10 years? And what are the actual activities I'll be doing on a day-to-day basis? And, I couldn't do it. I couldn't visualize myself as happy in that type of position. And I think that was the turning point. And just talking to a lot of friends and family and, especially the people that are closest to me, it came down to, I knew I had an opportunity here and I never wanted to wake up down the road and say, man, I wish I would have tried that. That would have been really cool if I would have done that. And that was the trigger, and with the encouragement of others, I just went out there and jumped off the cliff. Now it wasn't complete, total 100% risk now. And maybe I can fill you in on some of that too, like a transition if someone wanted to get into that, but
okay.
We'll go whatever direction you'd like.
Gotcha. Well, actually that'd actually be pretty cool to know just how exactly, cause most people, like when I spoke to other people who are entrepreneurs or people who kind of do similar things, they all said it was just like, okay, that's it. I know this is what I want to do. I'm just going to risk it all. So it was kind of so you had like something to fall back on or?
Yeah, man. It's not that simple of just making a decision and going, right? Because I feel like, as pharmacists, we're pretty conservative folks. And, and even the people that I'm trying to recruit now who are in pharmacy still, number one, you got to convince them that, what their life plan that they have had for a while is going to change, and that's okay. But number two is just like joining a startup, like that seems pretty risky, right? But the thing is that, I did my best to mitigate my risk. And, I'd started working and making sure that the start thing was what I wanted to do while I was working full time until I get to the point where, it just wasn't feasible. I was putting in 80, 90, 100 hours a week, like staying up so late, just trying to do the work on top of the regular full-time job. And, just got to a point where you're just like, this isn't sustainable. I got to do something different. So I've been doing some contract work, some consultant work in healthcare technology, health IT, developing data sets and standards. And I could do that work on my own time, hourly. And I found a way to essentially get paid enough money by doing about 20 hours a week of work that it's just going to cover the bills. It's not going to, drain my bank account from, low where it was to zero. And I'm just going to be running out of time. You got to have a little bit of flexibility in there to figure out exactly how you're going to build a business if that's what you want to do. And so I found a way to cover the bills. I didn't have a whole lot of money coming in at all. You just got to, eat some ramen noodles or go back to the college days. Luckily, I wasn't too far out.
Wow.
And when you do that, it gives you some time to marinate on it and really work hard and make contacts and learn what it is that you need to do to start a business. And I knew above all, like if all this crashed and burned, I still have my pharmacy degree. I've got my license. I can turn around and go to an independent pharmacy and get a paycheck if I really wanted to. That was obviously the last resort, but I knew that I had that, plan B and plan C. Some people tell you never have a plan B, always have a plan A. Well, that was definitely my mindset, but I knew better, and I knew I needed something to fall back on. So, in default on my loans, right?
Exactly. Wow. No, that's honestly, that's really amazing that you just kind of, you said you were working basically a full-time job, and on top of that, you were working on starting up this business at first. When you first initiated, 80 to 90 hours.
Man, that's what it's what you want to do. And that's some of the first advice I give to people that want to like get into entrepreneurship and business is you got to love it. You have to love the work, because if you don't, you're more miserable than you are currently at your current job. You know what I mean? I mean, you really got to love it, because it's going to be hard. Oh
yeah, absolutely. And Sam, because you told me when you first started out after residency and you were working, just you didn't feel fulfilled. But ever since, so now that you've started Docstation and it's doing pretty well so far and things are looking good, just do you feel like it's been significantly more fulfilling to be a business owner in the field of pharmacy as opposed to walking the typical path of just community, hospital, just what you think of a typical pharmacist does?
Yeah, man, I would say most definitely. I'm much more fulfilled than I think I could have ever been working in the hospital setting or even a community setting. And the reason for that is because, when you're working for an organization, you have a lot of freedom. The job that I was in, I had a lot of freedom to, pick the projects that I thought were going to be most beneficial to the hospital and to the patients we served. But you're usually met with some sort of barrier or, red tape or something that, is not there on purpose to bug you. It's just there because that's the way that it is. There's layers, right? And I figured out that the only way to really make the change that I knew I wanted to see was to do it on my own. I tried convincing so many different people that this was a good idea, but, couldn't get the resources, couldn't get the approval to do so, didn't have the time to work on it. And so, when you have something in mind and a vision that you want to, accomplish, sometimes the only way to do it is under your own auspices and starting out and starting your own company. And so, that's what it came down to.
Mm-hmm. So you kind of gathered the resources on your own type thing.
Yeah, exactly. Had to figure it all out on my own, and I knew nothing when I got started. I'll tell you that much. But you gotta jump in with both feet, and you learn things along the way.
Absolutely. And Sam, I do appreciate you just sharing kind of your story and how Docstation became Docstation. But just one last question I wanted to ask you before we let you go is that, so a lot of people right now in pharmacy school, and we don't have much exposure to this whole consulting idea, or how can we be entrepreneurs? We're not experienced in this type of field as pharmacists. As you said, we just kind of go through our clinical training and we graduate, and we just think there's really 2 or 3 paths: industry, which is pretty unlikely, or just hospital and community. So for you, what would you say for people who are aspiring, who really love the idea of consulting? What's some advice you would give all of us as students, and just maybe even pharmacists who just got out and don't like what they're doing in the community or hospital?
Yeah, great question. I think number one, it starts with you. What is it that interests you? And figure out what your super niche is. Your niche might be, pediatric pharmacy, but you might have a super niche where you're really excited about, some sort of dosing on a certain drug that just came out, or if you're in administration in a hospital, maybe it's like IV robotics, right? Mm-hmm. Once you have a niche, then you can become an expert, and that prepares you to go into some sort of consulting or contract work later on. So that's kind of the first step, and you can get started doing that as early as possible. But the biggest thing is just finding mentors that are doing things that interest you, that are doing things a little bit different, right? Yeah. And there's a whole bunch of alumni at every college of pharmacy that have gone a non-traditional route, and so, working with the faculty, working with, through alumni events and just asking around, do you know anyone that might be doing some sort of work like this or like that, or have started their own business, or, and once you get to talking to those people, that's when you realize that what you want to do is not all that different. Other people have done it before. And, there can be a little bit of a playbook, right? A guideline that you can follow to get you set up to get there. And more often than not, these people, people like myself want to help people like you and others who are interested in what we're doing, because it is different and it is lonely sometimes. Mm-hmm. And we want to change the context. And instead of being like, like 3-pronged options that you mentioned, maybe there's a 4th prong. Maybe it's doing your own thing. And, we're here to help you however we can.
All right. That's awesome. And you guys heard it here. If anyone needs someone to talk to about maybe starting up their own business, you can reach out to Samm Andregg potentially. All right. And we do appreciate your time today, Samm. And thank you so much for everything.
You bet. Thank you, man. I'll talk to you soon.
All right. Bye-bye.
Support for this episode comes from Goodnight Pharmacology, 350 brand and generic name drugs with classifications, a leading resource for students in the United States, United Kingdom, and Australia. Print, ebook, and audiobook available on Audible, iTunes, and Amazon.com. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.